Hi, thanks for joining me today. So we can talk about, are your arteries on fire? And we're going to focus today on what tests we need to check for that. Okay. And this is part of our series from the Healthy Heart, Healthy Brain book by Doctors Bradley Bale and Amy Doneen. My name's Linnea Baker. I'm a board certified family nurse practitioner and excited to be here with each of you today. Thank you for giving me so much of your valuable time. And I hope this brings you value. Okay, so first we want to talk about the inflammatory biomarker tests and what the goals are. So there's four important goals that they talk about in the Healthy Heart, Healthy Brain book. The first one is primary prevention, and that's identifying patients who are at risk for developing atherosclerosis. So we're catching the arterial inflammation, the inflammation of the artery wall, before they ever have plaque develop, okay? So we want to catch it early before there's ever any problem so we can treat it before it becomes a problem. Secondary prevention is when we find out if people with arterial disease, they've already been diagnosed with arterial disease, we want to know if they have dangerously, quote unquote, hot arteries, those inflamed arteries. So they can be put on the right therapy to prevent heart attacks, strokes, dementia, and other chronic diseases. So they've already been diagnosed with it, and we're checking to see if their arteries are inflamed so that we make sure that we're giving them the right treatment. Tertiary prevention is when we check patients who have already survived a cardiovascular event for this arterial fire, inflamed arteries. And we want to extinguish the blaze before they suffer another event. So they've already had a cardiovascular event, like a stroke or heart attack, and we're trying to get their inflamed arteries to cool off, to calm down so they don't have another event, okay? And then monitoring is how we check. We're checking for patients' response to treatments to find out if the therapies we're using that are prescribed have actually worked successfully and are quote unquote cooling off the inflammation in the artery wall. And it's the lining of the blood vessel of the artery, okay, is what we've been talking about. And if you haven't seen any of the other presentations we've done from the book Healthy Heart, Healthy Brain in this series, please feel free to go back and look. They are all located in this private Facebook group as well as on my YouTube channel. Okay, so what's the FIRE panel? There are 6 labs to check for arterial inflammation that we're going to talk about. These tests are inexpensive labs and urine tests. They can all be done in the same medical visit. And according to Healthy Heart, Healthy Brain, they say that the cost can vary, which is pretty typical wherever you are in the country and whatever your insurance plan is. But usually they are less than $150 for the entire panel of tests. They are often covered under insurance plans, but we can't guarantee that. But many of them are usually covered under your insurance plans. And they recommend the Bale-Doneen method from Healthy Heart, Healthy Brain, the doctors that wrote this book. They recommend tests be done annually, so once a year, even if you have normal results. And they also talk about in the Bale-Doneen method in this book that they retest their high-risk patients every 3 months and their medium-risk patients every 6 months, okay? So they definitely feel like this is not a one and done. We need to keep checking depending on what your risk is, even if they're normal. And if you have abnormal results on any of the 7 tests that they discuss, it's extremely important to identify and treat the root cause of the inflammation. It's great to know you have inflammation, but if you don't treat it, you're setting yourself up for risk for these cardiovascular disease events as well as other chronic diseases. So definitely the whole point of doing this is to do things to help mitigate your risk, right? To lower the inflammation. So I love this one. How fast is your body aging? And they talk about these F2 isoprostanes. And they call this the lifestyle, in the book, Healthy Heart, Healthy Brain, they call this the lifestyle lie detector test. And I love that because so many of us, and I've been there too. I didn't think I was that unhealthy before. Over 3 years ago, before I started my real dive into my holistic health and wellness journey and just learning more about it and doing things that were better for me, I was living the typical American lifestyle. And even though I was a little bit better than most, I had a lot of chronic inflammation and things going on in my health. I was diagnosed with an autoimmune disease. I was gaining weight. All of these things of inflammation that we talk about were happening. And I didn't even know it, having been in the medical field for well over 20 years at that point and being a nurse practitioner. So the reason I'm here is if I didn't know, I know the majority of us don't know. I know in talking to clients and talking to other healthcare providers and other people in medicine, as well as lay people, it's just not known because we have normalized the lifestyle, the American lifestyle, which is highly processed and sedentary jobs and not getting enough sleep and grinding it out and feeling miserable and thinking that's normal and we should get some kind of award for pushing ourselves to the max degree. And that's not how what our bodies are designed to do all the time. And that chronic stress and that normal environment of what we're doing in our culture with the way we eat and our low level of activity and all the things, it's creating chronic disease more and more in our society. And we're seeing that in the numbers and in the statistics. So this lifestyle lie detector test, it's a good wake-up call to let us know if what we're doing is actually working. And then also just being more aware and mindful that of what's really going on and what we could work on to help ourselves. And they say in the book, since lifestyle, and this is a direct quote, since lifestyle is the most important therapy for chronic disease prevention, this test helps motivate patients to practice healthy habits. Lifestyle is the most important, guys. And that's why I do what I do. I am no longer in the four walls of a clinic. I'm here giving education. I do health and wellness consults for people, and I help them do an individualized plan to get them on a healthy lifestyle journey because it's hard to know where to start and it can be really frustrating. And I have tools in my pocket that can help you. So feel free to reach out to me for a look at what's going on with your lifestyle and how we can tweak it and make it better to work for you instead of against you. Okay. So I love that. They have this blood test. I was not aware of that before I read this book. It actually, the blood test, and this is another direct quote from the book, it said it reveals that how fast your body is aging on a cellular level. So I'm definitely going to get this test done. I'm excited to get it done. The F2 isoprostanes are a biomarker for oxidative stress. And I always say oxidative stress on our body creates because of the free radicals that are building up, it's basically how your body's rusting out on the inside. So just like a piece of fruit can rust or a piece of metal can rust, when we have high levels of oxidative stress over a period of time, we're rusting out our body from the inside out. And this is saying this is a test to show us what our body age is at a cellular level, not the age in numbers, but what our body on the inside looks like. And I love that. So I will be getting this test done and I'll have to let you guys know. Oxidative stress is caused by an imbalance of free radicals and antioxidant defenses. So when we have too many free radicals and not enough antioxidants to fight it off and stabilize it, it's basically stabilizing it. And how do we get antioxidants? We ingest them through mostly fruits and veggies. That's how we balance it. Then that's what's causing this oxidative stress situation is when there's that imbalance. And oxidative stress increases the platelet-derived growth factor, which is one of the strongest sparks of arterial disease. So platelets are sticky. They help stop wounds from bleeding. And so they're saying when we have high oxidative stress, we're increasing the platelet growth factor, and that's sparking arterial disease. So that kind of stickiness of the platelets that's leading to more problems with our arteries and overall cardiovascular disease. And oxidative stress is pro-inflammatory on multiple levels. So that means it's causing inflammation throughout your body, including your arterial wall lining, the endothelium, which is the lining of your blood vessel that we've been talking about. So just having oxidative stress alone is creating chronic inflammation in your body. So how do we slow down aging? And this is a quote: the key to slowing down aging and protecting our cardiovascular health is achieving a balance between destructive oxidation and antioxidant defenses. Among the ways you can strengthen your antioxidant defenses and slow the rate at which your body is, quote, rusting, and we talked about that before, is by following healthy habits, including avoiding smoking, eating a Mediterranean-style diet that's high in fruits and vegetables and low in saturated fat, managing the stress in your life, and exercising regularly. So part of holistic, healthy habits and lifestyle. And I love that they focus on this as well as other things in the book, because we're finding that yes, you need to go in and see your Western medical healthcare providers who know you best and get the labs and see what your risk factors are. And absolutely, there is a fit for Western medicine with holistic health and wellness. But we have to also focus on what we're doing holistically with a healthy lifestyle journey, because if we're not doing that piece, we're reactive instead of proactive. We're trying to put the fire out all the time with medication and procedures and all these things, which are needed at times. But what if we took better care of ourselves? That would help decrease this, quote, rusting out, and help our insides be as healthy as what we want to look like on the outside, right? And help us maybe avoid some of these other long-term chronic illnesses that can happen when we don't take care of ourselves, or at least delay them. And maybe they won't be as severe if we do have them. So is your blood vessel lining inflamed? Well, tests that can tell, according to the book, they recommend the fibrinogen test, which is a blood test, the high sensitivity C-reactive protein test, which is another blood test, and the microalbumin creatinine ratio, which is a urine test. So when we look at if your blood vessel lining is inflamed and we focus on fibrinogen, the blood test, that fibrinogen is actually something that's in our blood that helps to form blood clots, which helps stop bleeding and helps heal wounds. It's also additionally a marker for inflammation. So abnormally high levels in the bloodstream of fibrinogen can be dangerous, and it actually can contribute and work against us because it can contribute to the clotting cascade leading to heart attacks and strokes. But they also found that high fibrinogen levels are also linked to diabetes, cancer, and high blood pressure. And fibrin is also often elevated in people with metabolic syndrome. So symptoms of metabolic syndrome we talked about was elevated cholesterol, blood pressure, increased waistline, insulin resistance, which goes along with elevated blood sugar, those types of things. Okay, so is your blood vessel lining inflamed? Now we're going to talk about high sensitivity C-reactive protein. And CRP is actually a protein produced in the liver. It rises in the bloodstream when there's inflammation in the body. The thing about CRP, though, and we've talked about this a long time ago when I talked about inflammation, CRP is not selective for arterial disease. It's not specific. It rises with all kinds of different types of inflammation in the body. So other reasons that CRP or C-reactive protein might go up would be if you have an infection, if you have an injury, if you have a fever, if you have an inflammatory disorder like rheumatoid arthritis. I have an autoimmune disease, so a lot of times mine will be a little elevated because of that. There are large studies, though, that still consistently show that an abnormally high CRP level can be a strong predictor of cardiovascular danger. So it's still important in kind of the workup to see if we're having inflamed blood vessels or inflammation in our body, that they still recommend doing this according to the Healthy Heart, Healthy Brain book. So when we look at is your blood vessel lining inflamed? We're talking about the arteries. They also recommend a microalbumin creatine urine ratio. And that's a urine test that's looking for a small amount of albumin, which is a blood protein. And when we have protein in our urine, that's actually abnormal. Albumin as a protein is a large molecule, so it should not be able to be filtered out down through the kidneys and go through the capillaries of the kidneys and get into the urine. So if these large molecules are getting into our urine, that means there's something going on that's wrong with the capillaries in the kidneys, because it should not be able to pass through into the urine. It should stay circulating in the blood. So this test is actually checking as a biomarker for endothelial dysfunction, and the endothelium is the inside lining of arteries. It's an indicator of arterial disease. So if our capillaries in the kidneys are allowing that protein to go through, that's telling us there's something wrong with the blood vessel lining there, because it shouldn't be allowed because the molecule is too big. And the test compares the urine ratio of microalbumin to creatine, and creatine is a waste product of muscles. And an abnormal urine albumin creatine ratio is a warning sign of cardiovascular danger. So even if your fibrinogen and highly sensitive CRP are normal, if this urine test is abnormal, the other two are normal, it's still a high predictor and warning sign of cardiovascular danger. Researchers are saying that an elevated urine albumin creatine ratio is found to have 20% higher ratios of cardiovascular events, even when other risk factors are taken into account. And this test, the microalbumin creatine test, is more accurate than a conventional urine albumin test that they would usually use on an annual physical, because it takes into account how much water the person consumes. So they're looking at the concentration, they're looking at other things. So it's much more accurate than just doing the normal albumin urine test they would do on an annual physical. So this one's more specific. Okay, is your blood vessel lining inflamed? This is a big word. Don't get blown away by the words. It's more about the impact of why we need these tests. I know I was kind of looking at it like, oh, that's a big word, but it's lipoprotein associated phospholipase A2 or LPPLA2. But what we need to know is this test measures a blood vessel specific enzyme, which is mainly attached to the LDL, which is considered the bad cholesterol. And in December 2014, the FDA cleared this test to screen all adults for risk of future cardiovascular disease, whether or not they had a history of cardiovascular disease. So this is evidence-based and FDA approved, and it's a biomarker for the arterial wall inflammation, right? Because it's dealing with blood vessel specific enzyme. So it's a biomarker for arterial wall inflammation. It predicts cardiovascular risk as accurately as a person's blood pressure or cholesterol levels. Also important, and we've talked a little bit about our teeth and dental hygiene and gums lately, but people with periodontal disease are almost twice as likely to have elevated LPPLA2 levels. So that's another thing to worry about. We said our mouth and our teeth are kind of telling us what the inside of our body looks like. And if we have periodontal disease, there's a link also between having elevated levels of this. So definitely wanting to get in with your dentist and healthcare providers and make sure you're taking care of your dental hygiene as well as your insides, okay? And the LPPLA2 test looks for, quote, fiery plaque hidden inside the artery wall that might erupt like a volcano. So this is another test that's good to check and see where you're at for blood vessel lining inflammation. And are you in imminent danger of a heart attack or stroke? This is the myeloperoxidase or MPO test. Again, don't worry about the name so much as what it does. You can always get the book and bring your book to the provider. You can highlight and take notes on different tests you think would be helpful to you and have that conversation with your personal healthcare provider or specialist. But this is an FDA-approved blood test as well, measuring that MPO level. And all that is a white blood cell derived inflammatory enzyme that the immune system uses to fight infection. So normally an elevated MPO level is only found at a site of infection. But when in this Healthy Heart, Healthy Brain book, the Baldonine Clinic, when they're seeing their patients, they're finding it's elevated alongside dental infections. They do feel that the MPO appears to be genetically influenced. And they said that the MPO is the worst of all the inflammatory biomarkers we've been talking about. And they said elevated, and this is a direct quote, elevated levels of MPO strongly predict future risk of coronary artery disease in healthy people, regardless of all other known risk factors. So another great test to have checked. And they said one reason for the increased danger is that it produces this MPO produces numerous antioxidants that make all cholesterol compounds more inflammatory. And it also reduces nitric oxide, which helps to protect the endothelium lining. Nitric oxide is known for its protective effects on the lining of the arteries, the endothelium, and so that lining in the blood vessel. So it's reducing what helps the blood vessel, and it's also making all cholesterol compounds more inflammatory, guys. So what are our action steps? First, schedule a consult with your primary care manager or specialist and have a discussion about getting some labs and workup done. Share your concerns, see what your risk factors are. I highly recommend you get the book and read through it because there's so much great information in there, but you can also highlight tests and show your healthcare provider where you're getting these recommendations from because they are evidence-based. and have that discussion about what would be good for you, and advocate for yourself. You can also reach out to me to schedule a free health and wellness consult to look at the holistic health and wellness side of things, so that I can help give you steps if you're feeling overwhelmed or frustrated or nothing works or having trouble with consistency. I get it. Life is busy, it's hard, and I'm here. There's no judgment. I've been there. I have family members and friends that have been there. I am passionate about serving others and helping others and getting you on a system, a routine, any kind of healthy habits, anything in the positive direction. Any little change will help make a big impact. So it's progress over perfection. Also, referring your friends and family members to me that you care about who need support and guidance getting on a healthier and holistic lifestyle. Maybe listening to these presentations or seeing some of the posts I make makes you think of someone you love that could benefit from this. So refer them to me and send them my way and see if they would do a consult, or invite them to this group. Invite friends and family members to this private Facebook group, this health and wellness group, Live Your Best Life, so they can hear this information and that could save their life. It may sometimes hearing it from other people outside the family helps. But I am passionate about education and empowering you to advocate for yourselves, get on a health journey, get in with your healthcare providers, get some workups done, and let's get you to living and thriving instead of surviving and dealing with chronic illness all the time in this country. And as I always say, I'm on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. It's about you and your families. When we start a health journey, it ripples out into other areas of your health. So it's holistic. We focus on the whole person, not just nutrition, not just sleep or exercise. It's all of it, because it all plays a role in this. And what you're doing is setting the example, because more is caught than taught in children, and your children are watching, whether they're your children directly or you're an auntie or however you've been blessed to have children around you and in your life. And we want to help teach them healthier habits so they live a long, healthy life. Again, reach out to me by commenting below or private messaging me to get a free health and wellness consult. And this is the book that I based this information off of. It's powerful. It's written for lay people, so you do not have to have any medical background to read this book. I got mine on Amazon. Like I've said before, I have no ties to this. I don't get anything out of this other than I think it's a powerful resource for people to help be proactive no matter where you're at in your health journey, whether unfortunately you've had an event or you're at high risk or you're not sure if you're at risk. This book covers everything. And I would love for you to get your hands on it so that you can read more, since I'm only covering highlights and nooks and crannies, and there's so much in this book to cover. I wouldn't be able to cover it all. So that's why I recommend you get it. It's also a great resource to bring to your healthcare provider and show them where you're getting this information and why you want certain tests done or think you need them. Okay. Guys, again, thank you so much for your valuable time. I am grateful for each of you who are plugging in, and I hope this information is bringing you value. And please share, comment, reach out to me. I am on a mission to serve others and use any experiences and any education that I have to serve you and help you on your own health journeys and living a long and healthy and thriving life, high quality life, right? Thanks again. And until next week, guys, be safe.